Hi there, beautiful mom. So pregnancy is not the only time that you have symptoms, okay? In this video, we're gonna talk about the symptoms that happen during postpartum, some immediate, some a few weeks after. Today, we are going to dive into all these surprising symptoms. If you're new here, my name is Adetutu and I am a board certified women's health nurse practitioner. And on this channel, we learn about all things related to our body. So that's gynecology, pregnancy, and postpartum. If that's of an interest to you, go ahead and click that subscribe button for more. Let's get into it. So the first symptom that a lot of women experience almost immediately once baby comes out is that extreme thirst, okay? Now, if you have done this before, then you know that hospitals actually provide big water bottles because this is expected, right? A lot of moms are extremely thirsty. And we're gonna talk about why that is, okay? So first, from the overworking of labor, right? From all the work that you just did, that your body just did, whether you went through C-section or vaginal, it causes you to be extremely thirsty. You are dehydrated. And also the blood that you've lost, right? Now you need to replenish it, right? So you're dehydrated from that, from the hormonal shift as well. Breastfeeding, right? So now your body is also trying to initiate breastfeeding because once that placenta comes out, then the hormones rush in like, oh, we need to start making milk. We need to make more milk because baby is here and we have to feed our baby, all right? That causes a lot of thirst, all right? So extreme, and when I say extreme, I mean extreme. You're downing bottles in a day of water. So you want to make sure that you are having a lovely bottle, a big one, as big as you can get, that you are just drinking and you are drinking along the day, all right? I don't even really need to tell you like, oh, drink water whenever, somebody holds the baby, drink something. You are going to want to drink water. There's a desire, there's this extreme thirst of you wanting to drink water. So just make sure that it's ready. I loved it cold and I was just like chugging. It was honestly so refreshing. Like water tasted so good. Okay, the next symptom during the immediate time when the baby comes out to you, the next one is that first pee. Expect it to be uncomfortable. All right, that first pee that you have will be burning. Whether you have C-section or vaginal birth. We're going to talk about vaginal births first. After baby comes out, there are, a lot of stretching that happened, right? Lots of swelling that happened. You may have had a tiny tear, right? Baby coming out from there, your uterus is right there, right? And the hole where your bladder comes out of is on top, right? It's right in there. So when you pee, because urine is acidic, so it's going to burn. So expect that when you pee, because of that urine, it's going to have a burning sensation. Now, whether you have C-section or vaginal, C-section is also going to burn because of the irritation you may have had from the catheter, because they place a catheter so that it can help you urinate. It can help you pee when you're in labor, okay? Because you have the anesthesia, you're not able to feel down there. So that catheter can also cause swelling. It can also cause a little bit of discomfort. So when you pee, the first peeing sensation will probably burn, mom. What can help with this are peri bottles, right? So before you have that first pee, you want to make sure that you get yourself a good wash with a peri bottle. You just get down there and you wash, you try your best. The first wash is also very painful because everything is swelling down there as well. So you just try your best. You wash everything off. You're using witch hazel to help you with the soothing after you wash. Also, your first pee, do it with your first bath, right? So when you're in that shower, you're doing it together, that cooling sensation to kind of help you, right? So you're washing, and then after you wash, you pee, and that can kind of help you a little bit with that stinging, all right? And then again, pat dry while wiping. Now the first urination is going to burn, but also expect it for the next few days, right? Because things are going to be swelling down there for a while. Now, what is not normal though is the stinging continues, there's burning sensation that's getting worse, right? And you are peeing more frequently, like you're peeing, but you're not emptying out your pee, right? Peeing is hurting you, especially it's hurting you from the bladder, like inside, right? Those are signs of a UTI. Watch out for fever and things of that nature, and report that to your doctor immediately, because you don't want to have a UTI, especially postpartum. Your body is very sensitive and we don't want it to turn septic, okay? Meaning that the infection moves to all other organs in your body. So make sure that if the stinging does not stop, right, that you are bringing the attention to your doctor. They send the urine test in, and if there are bacteria in there, they'll give you the antibiotics for it. Okay, mom? And since we're already in the same vicinity, we're gonna talk about the next symptom you should expect, mom, right after baby comes out to you. And this one is the constipation struggle, okay? Expect for the first few weeks for poop to be a little bit of a struggle, okay? The reason is because of so many things. Of course, number 1 is hormonal shift. 2 is your weakened pelvic muscle, right? 3 is possibly because of the medications that you get. Let's say you do get anesthesia, right? Those things slow down your peristalsis. So they slow down the muscle contractions that are moving and pumping to move food along, okay? Through the tract so that it can go to your colon. It slows that down, all right? So expect that in the first few weeks. Now, a lot of providers expect this and they send you home with things like Colace and Senna, which are stool softeners, okay? So make sure that during postpartum, you are drinking a lot of water. You're already gonna want to, right? But drinking a lot of water will help with this. Eating fiber-rich foods, okay? Getting those chia seeds in and that flax seeds, adding that to your morning yogurt. So things of that nature can kind of help you with that constipation struggle. And take the medications if needed. If you are noticing that you are bearing down, because you don't want to do that, it's going to be very uncomfortable, especially if you had a tear, right? If you had a tear, it's going to be uncomfortable for you to be bearing down, pushing up to that vaginal area, and we don't want that for you, mom. So you don't want to bear down, because you also don't want to give yourself hemorrhoids, right? So we want to make sure that you are just allowing the bowel movement to fall down. So take your stool softeners as prescribed, which can help you in the meantime once your system picks back up. So what's normal? What's normal is not having a bowel movement a few days after you deliver that beautiful baby. What's not normal is after 2 days, honestly, of nothing, no bowel movement, you do want to reach out to your doctor. If you are having a bowel movement and you are seeing blood in the poop, that's a red flag. That's something that you must mention to your doctor as well, okay? And then the next physical symptoms that you should expect, mom, after pushing your baby out, pretty much immediate. It was immediate for me, is the hunger pang, okay? Now, I'm gonna explain this hunger pang. So the symptom that comes with the baby coming out now is less nausea, right? Or less of that discomfort or not wanting to eat. You know, the hormones are, the shift of the hormones now is gonna make you want to eat. You're not gonna have the same aversions that you had to food when you were pregnant. 1, that's one of the reasons why you're so hungry. 2, you just did a lot. Your body just went through a whole lot. So of course, you need to replenish that energy back. So you're hungry. 3, the desire now to eat whatever it is that you want to eat, right? Because I know during pregnancy, one of the most common conversations I know a lot of women have is, oh my gosh, I could not wait to have my first meal where I am not uncomfortable, where I don't have heartburn, where I don't feel nauseous, where I don't have a strong sense of smell. So that desire, now that all of those symptoms are gone, you're like, give me the best meal ever. Give me my favorite meal ever. I know that I was literally in the last few weeks watching people make my favorite food. And I'm like, I can't wait to eat that. Because there was no way. I could not stomach it while I was pregnant. I couldn't really stomach food while I was pregnant. So I was like, I can't wait to eat. I can't wait to eat. So I literally requested for my family members to make sure that this food is ready for me right after my babies come out. Right after, I was smashing, y'all. I was eating up everything. I was eating up everything. A popular one that I know a lot of moms love is they want to eat their deli meats, right? So in the States, you know, the turkey sandwich or, you know, bologna or whatever, they want to eat the deli meat. So in the hospital, cold cuts are something that are always in the fridge. That's like a common food that we give a lot of patients. And when I tell you, moms, like, it's like the biggest and best meal for a lot of moms. They're like, bring me a turkey sandwich right now, because you can finally eat it. Because you know you can't eat deli meats since they're cold, right? And they possibly can have a bacteria called Listeria, which is very dangerous for baby. So that's not something that moms are supposed to eat during pregnancy. But after pregnancy, once that baby comes out, eat away. So a lot of women, they want sushi, they want their dairy, they want all the things that they could not eat while that beautiful baby was inside. But now that baby's out, you're like, give me all the foods. So expect hunger pangs, and again, prepare for it, right? Have your family members and your friends, like, you're coming to visit. If you're coming to see me and this beautiful baby, your entry fee is my favorite food. So I need you to go to this restaurant. I need you to, bring me this, and that. And then you're welcome to come in. So mom, I want you to comment below what food you cannot wait to eat once this baby comes out. What food are you looking forward to enjoying again, that you're like, I cannot wait to eat this food? Comment down below. And the next symptom to expect after that beautiful baby comes out to you is heavy bleeding. Now, this one should be expected, mom. You should expect to have a lot of bleeding, right? Whether vaginal, whether C-section. Now we're going to talk about the next few days up to weeks of what you should expect, okay? And what red flags that you should be paying attention to. Day 1 to 3, you should expect a heavy bleeding. You should expect a heavy, red, bright bleeding, right? So the placenta came out, baby came out from there, your uterus has literally a big wound in there, right? So first of all, it's trying to clear out, it's trying to heal. The first 3 days, see it as a wound. Like when you cut yourself, right? You're going to expect it to be heavy, to be bright, to be more painful, right? The first day, expect to be changing your pad every hour, right? That is expected. From day 4, that first week then, after we move on from day 3, from day 4 to 10, around there, you are going to notice a moderate bleeding, right? You should no longer be changing a pad every hour. You should not ever be passing clots as big as a golf ball, okay? You should notice a decrease in the flow, and also you should now start to see, your blood is getting a little bit darker. Weeks 2 and 3, expect light brown or pink discharge. So now you're expecting that your blood is not looking as bright as red. It should now be like, let's say, day 4 of your period, right? Where things are just now getting a little light. It's not as bloody. You're still needing to change your pad, but it's not as often, right? And the pain should now start to decrease as well. And then weeks 4 to 6, expect, just like the end of your period, right? You're still having discharge, but it is not bright. It is not red at all. Just like that end of your period color, like the yellowish color, the light brown color. So expect that from weeks 4 to 6, okay? So here are the symptoms that you want to make sure that you are calling your provider for immediately, okay? So first is if you are soaking a pad every hour times 2 hours, passing clots bigger than a golf ball. If you have any temperature, fever is a sign of an infection. So anything more than 100.4 Fahrenheit, 36 degrees Celsius. Any foul smelling odor, okay? Discharge that just smells foul. If your bleeding was getting darker, okay, and getting less bright, and then all of a sudden it comes back with a vengeance and it's a bright red again, okay? Especially if it's after a week. If you are noticing severe dizziness, you're feeling very fatigued, you're feeling very lightheaded, okay? If your bleeding has not decreased after 4 days, you're still noticing the same heaviness, the same brightness, okay? If at any time you notice a sudden heavy bleeding, after it's lightened up, after it's gotten less, you notice a sudden heavy bleeding again, all right? So these are signs that you definitely need to check in with your doctor, okay? The next thing your body throws at you after delivering your baby is that emotional roller coaster, okay? So combined with the hormonal shift that just happened, right? Baby coming out triggers a hormonal shift, okay? And it's all over the place, especially in the first 2 weeks. Your body is trying to get back to its normal hormone level to restart your cycle. 2, not being able to sleep, right? Not being able to sleep because baby's not sleeping. And also this new change, right? This new life change. You have a whole new human to account for. So all of that can be very emotional. So the first 2 weeks, expect, you're laughing 1 minute, you're sad in another minute. So it's just like an emotional roller coaster. You're feeling overwhelmed. You want to make sure that you are checking in with your support people, postpartum therapists to talk through with, friends who's gone through this who can check in with them. I always say that first month is such a heavy month. It's so important for you to make sure that you are preparing for that first month, because it's a shocker. It's always a shock for a lot of moms. Like, I did not expect that first month to be as stressful or as overwhelming as it was. So I do want you to be prepared, especially with the emotional aspect. So have things lined up, like talking to your partner, having therapists lined up, talking to your doctor, asking for what you might need, asking for what are red flags. So the red flags after the 2 weeks, right, is if this is not getting any better, it's actually getting worse. You are extremely sad, extremely crying. You're not bonding with the baby. You don't want to do anything. You just feel extremely closed in and unable to really get out, kind of, like an emotional in. You feel a sense of like, hopelessness. You just feel like life is just really heavy. I'm going to leave the postpartum support international number here. Okay, this is great because it's international and you can call that number if you need someone to talk to immediately. If you don't have anyone to talk to immediately, this too shall pass. And then the next thing your body throws at you that you may be surprised with this one is the still pregnant belly. Okay, a lot of women, they're like, oh, my baby came out and I still look the same. Now I look like I'm like 30 weeks pregnant. So it's a shock for a lot of women, but do expect that you'll still have that pregnancy belly, okay? So why this happens is because your uterus needs to shrink back, okay? Your uterus is gonna need time to shrink back, the extra fluids in your body, the muscles that are now weakened. So all of that combined together still gives you like this look of being pregnant. Not to worry, mom. Again, this just takes time. A lot of women, they start doing wraps immediately. If you can tolerate that, sure. Just give yourself time. Give yourself time with all these things. Your body will be its postpartum normal, okay? I always say your body will never go back to the way it was. People want to look the same as they did when they were pregnant. Your body will never go back to the same that it was because you've now created life, right? And it's going to show signs and evidence of that. And whatever your new normal is, you just want to give it time for it to get to that. Now, a lot of moms, they start tying their belly after postpartum, okay? If you can tolerate it, if it's not too painful, sure. This is, of course, helpful because it helps the muscles, right? So it helps tighten the muscles. So if you can tolerate it, of course you can do that. It can help with the shrinking back. Now, these are surprise bonuses. You can get shakes and chills, a lot of times from the anesthesia, from the baby coming out, from the shock to your body, night sweats. You can also have hair loss. That is another conversation for another day. Okay, mom, so those are all the things that your body is gonna throw at you after having your beautiful one. Now, you got this. Your body is just trying to get back to its normal, okay? Now, if you feel like something is off or the red flags that we talk about, make sure that you are checking in with your doctor. You're going to the doctor, going to the hospital and saying something is off, going to the emergency room or urgent care and saying, can you please check on me? You have resource options, mom. Even outside of your prenatal provider, you have, moms who's gone through this. You can join groups. You can talk to other people. You can call this international hotline support group to find help in your area. Okay, help is available. All right. Again, I do hope that you are taking care of yourself, mom, and this too shall pass. You get through this just as you are going to get through pregnancy as well. If this was helpful, make sure you share this with an expectant mom and make sure you give us a thumbs up and subscribe to this channel to learn all things related to women's health. Again, I do hope that you are taking very great care of yourself. Thank you so very much for watching. I will see you next time. Bye.